Chapter 9. Objectives. After reading this chapter, you should be able to 1. Define key terms introduced in this chapter. 2. Describe the anatomy and physiology of the upper and lower airways. 3. Given a diagram or model, identify the structures of the upper and lower airways. 4. Describe common pathophysiologic problems leading to an airway obstruction. Demonstrate assessment of the airway in a variety of patient scenarios. 6. Associate abnormal airway sounds with likely pathophysiologic causes. Identify patients who have an open airway but who are at risk for airway compromise. Recognize patients who have an inadequate airway. Demonstrate manually opening the airway in pediatric and adult medical and trauma patients. A. Head tilt, chin lift maneuver. B. Jaw thrust maneuver. Describe the indications, contraindications, use, and potential complications of airway adjuncts, including oropharyngeal airway and nasopharyngeal airway. Recognize the indications for suctioning of the mouth and oropharynx. Describe risks and limitations associated with suctioning the mouth and oropharynx. Demonstrate the following airway management skills: inserting an oropharyngeal airway, inserting a nasopharyngeal airway, suctioning the mouth and oropharynx. Describe the modifications in airway management for pediatric patients, patients with facial trauma, and patients with airway obstruction. The cells of the human body must have oxygen to survive. The reason the ABCs, airway, breathing, and circulation, are so important is they are means by which oxygen is brought into the body and transported to the cells. In this chapter, we will discuss the airway, the A of the ABCs, and its role in delivering oxygen to the cells. You will learn that much of our primary assessment and treatment will focus on the airway. The reason for this is simple. When the airway fails, air cannot reach the lungs. When air cannot reach the lungs, oxygen cannot be delivered to the cells. In essence, without an airway, the patient will die. As you proceed through this chapter, keep in mind how important this statement really is. In the Anatomy and Physiology chapter, you reviewed the anatomy and physiology of the respiratory system. In preparation for this chapter, you should study the following structures of the respiratory system and be able to label them on a blank diagram of the respiratory system. Figures 9.1, 9.2, and 9.3. This chapter will also discuss a variety of topics you have previously covered in the CPR course you took as a prerequisite to your EMT course. This information included providing rescue breathing, performing cardiopulmonary resuscitation, or CPR, and treating airway obstruction in infants, children, and adults. We will discuss each of these topics, but for more detail, you should review Appendix B, Basic Cardiac Life Support Review, at the back of this book. Airway physiology. The movement of air into and out of the lungs requires an intact and open airway, or patent airway. That means that airflow is unobstructed and capable of moving freely along its path. In the upper airway, figure 9.2, air enters the body through the mouth and nose. The nose is specifically designed to accept air, and through a series of turns and curves, air is warmed and humidified as it proceeds through the nasal passages. The mouth is primarily designed to be the entrance to the digestive system, but it is also an entryway for air, especially in emergency. Posterior and inferior to the mouth and nasal passages, air enters the throat, or pharynx. The pharynx is divided into three regions: the oropharynx, where the oral cavity joins the pharynx, the nasopharynx, where the nasal passages empty into the pharynx, and finally the laryngopharynx, the structure surrounding the entrance to the trachea. The laryngopharynx, also known as the hypopharynx, is designed to provide structure to and protect the opening to the trachea. It is also the point of division between the upper airway and the lower airway. The entry point to the larynx, called the glottic opening, is protected by a large leaf-like structure called the epiglottis. This protective flap that sits above the glottic opening is designed to seal off the trachea during swallowing or in response to the gag reflex. The gag reflex is when you feel like barfing. The glottic opening is also protected by the vocal cords. These curtain-like fibers that line either side of the tracheal opening not only can close shut for protection, but also vibrate with the passage of air to create the voice. The larynx itself is framed and protected by cartilage. The shield-like thyroid cartilage protects the front of the larynx and forms the Adam's apple. The cricoid ring, a complete circle of cartilage, forms the lower aspect of the larynx and provides structure to the superior trachea. The lower airway, figure 9.3, begins below the larynx and is composed of the trachea, bronchial passages, and the alveoli. From the glottic opening, the air enters the trachea. The trachea is a tube protected by 16 rings of cartilage. These rings provide structure and prevent the trachea from collapsing. The top ring is the cricoid ring, which extends fully 360 degrees around. In the other rings, the cartilage extends only about 3/4 of the way around and is connected posteriorly by smooth muscle. The trachea branches at the carina and forms two main stem bronchi. Remember, singular is bronchus, plural is bronchi, and it means branches. These large branches then further subdivide to form smaller and smaller air passages called bronchioles. All the air passages are supported by cartilage and are lined with smooth muscle. This smooth muscle allows the bronchioles to change their internal diameter in response to specific stimuli. The bronchioles end at the alveoli. Alveoli are tiny sacs that occur in grape-like bunches at the end of the airway. These alveoli are surrounded by pulmonary capillaries, and it is through their thin membranes that oxygen and carbon dioxide are diffused. Gas exchange will be discussed in greater detail in the chapter titled Respiration and Artificial Ventilation. It is important to remember that the bronchioles divide and travel in every direction. As a result, tiny bronchioles and the millions of alveoli they connect to cover most anatomic regions of the chest, from the collarbones to the diaphragm. So let's go over some of these diagrams. Thyroid cartilage, cricoid cartilage, trachea, bronchiole, right main bronchus, lungs. These are all figure 9.1, the respiratory system. Pharynx, which includes the nasopharynx and the orthopharynx. Epiglottis, larynx, carina, left main bronchus, diaphragm, bronchiole, alveolus. Let's review some of these sidebars. Core concept, physiology of the airway. Physiology means how the form functions. Airway, the passageway by which air enters and leaves the body. The structures of the airway are the nose, mouth, pharynx, larynx, trachea, bronchi, and lungs. Patent airway, an airway, or a passage from nose or mouth to lungs that is open and clear, and will remain open and clear without interference to the passage of air into and out of the body. Figure 9.2. the upper airway. Paranasal sinuses, nasal cavity, nasopharynx, pharyngeal tonsil, eustachian tube, hard palate, soft palate, oropharynx, palatine tonsil, tongue, laryngopharynx, epiglottis, vocal cords, esophagus, trachea, nose, mouth, mandible, hyoid bone, thyroid cartilage, cricoid cartilage, thyroid gland.